Recovery from a stroke can often feel like an uphill battle. A new treatment combining technology and therapy at BayCare's Morton Hospital is giving patients new hope. Joining us to discuss this is neurosurgeon Dr. Benjamin Fox. Welcome to the show, Dr. Fox. How are you today?
Doing great. Thanks for having me.
You know, I'm glad that you are here today because technology is changing the way we do everything, of course. Let's talk about what you brought today and how this technology is helping people who have suffered from a stroke.
Okay. So Vivistim is an implanted medical device that is placed in the left upper chest.
Okay.
It has an electrode that connects to the left vagus nerve in the neck that sends signals to the brain to help induce changes that create new connections to those areas of the brain that were damaged from a stroke.
Interesting. I mean, that can't even take me back. I mean, you think of something implemented in the chest to be able to do that and be able to make those changes. I mean, so many times you think after a stroke, you think of things like occupational therapy. Are you comparing and combining this treatment with occupational therapy as well?
That's a great question. So Vivistim device by itself will not work unless it is combined with therapy. So essentially the brain does not know where to induce this neuroplasticity by itself. So when the therapists are working with the patients, they're stressing those areas of the body and ultimately the brain that need help. And so when the Vivistim device is stimulating, it knows where to give those signals to create these new connections.
Interesting. Okay, that because it's not a one thing and you're done kind of thing. I love that you still are being able to use both of those ways to help patients. I got to ask about the improvements though. What improvements are you seeing when it comes to these patients in particular with being able to combine both of the treatments?
Great question. It's actually pretty remarkable. So our patients are having improvements in strength, coordination, function, decreased dependence on others, as well as improvement in quality of life. To give a few examples, we've had patients who couldn't eat for themselves, patients that couldn't dress themselves that are now able to do that, patients that weren't able to walk that are able to walk now. And essentially, it's giving these patients back hope for a more meaningful life.
This is such good news. I think so many times when you think of the families and those who have suffered from a stroke, it can be so intimidating, but to know this technology is out there. Dr. Fox, thank you for coming in and talking about this.
Thanks
of course, we want to make sure and share where you can go for even more information. BayCareStroke.org. Again, there's the information so you can revisit some of the things we talked about today.